Thank you, moderator, Dr. Teresa Cassava. Greetings to Dr. Tedros Ghebreyesus, Director General of World Health Organization, First Lady of the People's Republic of China, and WHO Goodwill Ambassador for TB and HIV and AIDS, His Excellency Professor Pen Liyung. Fellow panelists, let me express my appreciation for inviting me on behalf of my country to be part of this important session today. South Africa remains fully committed to the global goal of ending TB as a public health threat by translating international commitments into national action. In evaluating our progress against the United Nations high-level meetings target, South Africa achieved 84% of its notification targets. While we have seen a steady reduction in TB incidence, we are still lacking in our mortality reduction goals, with approximately 54,000 TB-related deaths recorded in the most recent reporting cycle. Furthermore, our data shows that 54% of TB-affected households still face catastrophic costs, reminding us that TB is a profound economic burden as well as a medical one. To address these challenges, we've launched the National End TB campaign under our TB recovery plan, which aims to test 5 million people annually. This initiative is modeled to drastically reduce both incidence and mortality by 2035. Innovation is central to our response, and we continue to scale up rapid molecular diagnosis to ensure faster, more accurate detection. We have recently introduced targets next one generation sequencing nationally to stay ahead of drug resistance, alongside the expanded use of digital chest X-rays supported by computer-aided detection. This allows us to identify TB earlier, even in individuals who do not yet show symptoms. I am particularly pleased to announce that following the new World Health Organization guidance, South Africa is now launching its pilot project for near point-of-care diagnosis tests. The essential step will move high-quality testing out of centralized labs and closer to the communities where our people live and work, supporting our drive towards universal health coverage. South Africa has consistently been at the forefront of introducing more effective treatment options, including betagualine. In September 2023, we launched the 6-month PEPAL regime for drug resistance TB and achieved rapid national implementation within just 6 months. This shift has significantly improved patient outcomes by reducing the burden of long treatment periods. As a result, our drug-resistant TB treatment success rates have seen a significant boost and are now reaching approximately 80%, a testament to what is possible when we prioritize rapid evidence-based innovation. As the country, we recognize that a new effective vaccine is the ultimate game changer for ending this epidemic. South Africa has already held a national workshop to develop a comprehensive TB vaccine roadmap, ensuring we are both trial ready and implementation ready. Globally, we are honored to co-chair the WHO TB Vaccine Accelerator Task Force on Finance and Access. During our G20 advocacy efforts, we continue to push for the sustainable financing and equitable access required to ensure that once a vaccine is approved, it reaches those in high-burden settings like ours without delay. TB is a biopsychosocial disease that thrives on poverty, and ending it requires more than just clinical interventions. Therefore, we have launched the South African TB Caucus to drive political accountability across all levels of government. We are also implementing a social and behavioral change communication strategy that involves the co-creation of messaging with TB survivors and affected communities to actively reduce stigma. Furthermore, we are working across sectors with the Department of Social Development, which has developed its own NTB strategy. This partnership is a direct response to the WHO's 2025 guideline on TB and nutrition, which underscores that nutritional support is a critical component of TB care package. By integrating these guidelines, we ensure our patients receive a holistic package of care, including social grants, food support, and psychosocial counseling, ensuring that the most marginalized among us are supported and throughout their entire journey to health. In closing, it is important to acknowledge that with strong political leadership, bold innovation, and a response to truly powered by our people, ending TB is achievable. This talk show serves as a vital platform to galvanize our collective leadership and turn our global commitments into measurable, life-saving impact on the ground. By standing in solidarity and taking decisive action today, we ensure that hope of a TB-free future becomes reality for every community. The theme of this year's World TB Day, Yes We Can End TB, led by countries, powered by people, is more than a slogan. It's a call to action that we can embrace with agency and determination. South Africa remains a steadfast partner in this global fight, ensuring that no one is left behind. I thank you.